Mental Health Reform and Insane Asylums by Amy Hernandez, Gabriela Marrero, and Alexander Rothman.
What is the Second Great Awakening? The Second Great Awakening was a religious movement in the United States during the early 1800s. It focused on reviving people's faith and encouraging them to live better, moral lives. This movement led to a rise in different Christian denominations and inspired social reforms like the push for women's rights, abolition of slavery, mental health reform, and temperance. The Second Great Awakening had a big impact on American society, influencing people's beliefs and actions for years to come. Who are they? The mental health reform movement emerged in the 1800s as a response to the inhumane treatment of individuals with mental illnesses, particularly in institutions known as insane asylums. In the U.S., reformers who recognized the humanity and dignity of those with mental health disorders were instrumental in promoting improved conditions. Patients suffered abuse and neglect at these asylums, which were frequently overcrowded and understaffed. Reformers emphasized kindness, regulated routines, and therapeutic activities in their desire for a change towards moral treatment. Did they come from another religion or movement? The reform of mental health care and the creation of these insane asylums were influenced by Enlightenment ideas, which viewed mental illness as a medical issue rather than a moral failing. Quakers and reformers promoted moral treatment, emphasizing kindness and peaceful environments. Religious movements like the Second Great Awakening, among others, ideas combined to shape asylums as places for treatment and care, though many later struggled to fulfill their goals. What do they do or stand for? Insane asylums were established to provide care and treatment for individuals with mental illnesses, focusing on a more humane approach than previous methods like punishment or neglect. The idea was to offer a structured, peaceful environment where patients could receive kindness therapy and routine to aid their recovery. While they initially symbolized progress, many later failed. Despite this, they represented an early attempt to address mental health in a more compassionate way. What did they accomplish and what were their goals? Mental health reform aimed to replace the old, overcrowded insane asylums with more caring, community-based treatment. Reformers wanted to provide better care. The goal was to help people with mental illnesses live more independently and integrate into society. However, while asylums were closed, there weren't always enough resources or support systems in place, making it harder for many people to get the help they needed.
Where did they originate and end up? During the Second Great Awakening, the U.S. experienced a shift in the treatment of mental illness. Influenced by moral and religious values, reformers like Dorothea Dix advocated for the humane treatment of the mentally ill, leading to the establishment of asylums that were intended to provide moral rehabilitation. The ideals of the Second Great Awakening shaped early mental health reforms and the construction of institutions designed to treat mental illness. However, by the mid-20th century, the rise of deinstitutionalization led to the closure of many asylums, and while the ideal of humane care persists, the challenges of providing adequate mental health care continue to evolve. These developments help to shape modern mental health care, which still grapples with balancing treatment rights and care for individuals with mental illness. Why are they significant? The mental health reform and the establishment of insane asylums during the Second Great Awakening were critical in the shifting of societal attitudes towards mental illness, from fear, punishment, and neglect to compassion, care, and rehabilitation. These reforms laid the foundation for modern mental health system and established the idea that people with mental illnesses deserve humane treatment, access to care, and opportunities for recovery. The religious and humanitarian impulses of the time also helped shape the future of social welfare and public health in the U.S., influencing how society responds to the needs of its most vulnerable populations.
Past, present, and future. The movement to reform mental health care begins in the 18,000s, largely as a response to poor conditions in insane asylums. By the early 1900s, new approaches like therapy and medication started to replace older, more extreme treatments. In the mid-20th century, a major shift called deindustrialization aimed to move patients out of insane asylums and into community-based treatments. Today, mental health reform continues as advocates push for better access to services, affordable care, and more acceptance of mental health. In the future, mental health reform will likely focus on improving mental health education, increasing funding, and using technology to make treatment more accessible and effective. Biographies. Dorothea Dix was an important 19th century reformer who fought for better treatment of mentally ill people and helped shape nursing. During a trip to Europe, Dix met reformers focused on improving mental health care, inspiring her to inspect U.S. mental health hospitals and report poor conditions to politicians. During the war, she became superintendent of Army nurses for the Union Army, setting high standards and recruiting over 3,000 nurses, advocating for the role of women in nursing. After the war, she raised funds for monuments to honor fallen soldiers. Dix continued advocating for better mental health care until her death in 1887 in New Jersey, leaving a legacy of compassion and reform. This is my primary source and my video.
Benjamin Rush. Benjamin Rush was a prominent physician, revolutionary, and social reformer, often referred to as the father of American psychiatry. He is best known for his pioneering work in psychiatry and his advocacy for humane treatment of the mentally ill. Rush believed that mental illness was a medical condition that could be easily treated scientifically rather than a moral or spiritual failing. His most influential work, Medical Inquiries and Observations upon the Disease of the Mind, was one of the first systematic attempts to classify and treat mental illness in America. In it, he connected mental disorders to physical causes such as disturbances in the brain's circulation and prompted to the idea that medical treatment could improve mental health. Rush's contribution to psychiatry were groundbreaking. He introduced the idea that mental illness should be treated as a medical issue, focusing on the scientific treatments instead of the punishment. He also emphasized the importance of humane care for the mentally ill, advocating for treatment that respected the dignity of patients. Though some of his methods, such as bloodletting, are now considered outdated, his belief in the importance of medical intervention laid the foundation for modern psychiatric care.
Second primary source and video.
Moral treatment movement. The moral treatment movement began during the Second Great Awakening, focusing on better care for people with mental illnesses. The movement stressed kindness, moral guidance, and structured routines instead of punishment. Thomas Story Kirkbride was a key figure, creating the Kirkbride Plan in the 1840s. His plan built large and bright hospitals in calm, rural areas, aiming to help patients recover through personalized care, work, and social interaction. While it improved care for many, overcrowding and lack of resources later caused problems. Despite this, the movement helped shift mental health care from harsh treatment to more compassionate methods and influenced future reforms like community care. The movement also raised public awareness about the importance of mental health, making it a more recognized issue in society. Its focus on humane treatment laid the foundation for later advancements in psychiatric care. This is my primary source and my video.
This is our final bibliography. And finally, our 15-question Quizlet review.